BMI Healthcare, we're serious about health and passionate about care. We want all our hospitals to be safe environments to work in, with our staff delivering high-quality outcomes for all our patients. To achieve this, we must strive at all times to improve the care we offer and embrace new, enhanced ways of working. We call it the BMI Way, and it's changing the way we think, communicate, and work together.
The business case for process improvement is simply this. The environment in which we operate is becoming increasingly competitive, and that's driven by two things. Insurance companies looking for value in a very flat insurance market, and NHS tariff going down year on year. And we need to respond to that. And in fact, we need to get in front of it.
We're the UK's #1 private hospital provider, and we need to be delivering excellent care every day. But we also need to do that efficiently, and we need to be sharing and adopting best practice. We have a number of hospitals across the UK, and our vision is for all of them to be delivering care in the best possible way every day. And the BMI Way is a way of knitting that together so that everyone's adopting best practice all the time.
BMI recognises the long-term benefits that a sustainable culture of continuous improvement can deliver, and the so-called lean operating system provides an overview of a new systematic way of working.
The benefits of the BMI Way are tangible. Predominantly, we focus on improving the quality of care that we provide to our patients, but also we get great results and improvements in staff engagement. People feel far more empowered to work and engaged in what they're doing on a day-to-day basis. There are also a number of financial benefits that we see on the back of this by people working in a more efficient and effective way. Ideally, we want our people to come in and think about how they can do their job in a better way every single day.
The benefits to the hospitals are very, very real. There is some hard work in the early days. You do have to put some time and energy and effort into doing it, but absolutely once you've got it embedded into the culture, the teams just take ownership of it, and it doesn't finish. We're always looking at ways to make more improvements. We're constantly looking at how we can make things better.
There's transparency, there's openness, there's honesty. I think the culture has been transformationally changed. We've managed to work in a much more communicative, collaborative and supportive way. So that's enabled us to provide a better patient safety and a better environment for our patients and our staff.
The BMI Way helps us to build quality checks into all our processes for safer and more streamlined working practices. An example of this is Pick for Case, where the materials team pick all the consumables for each operation at least 24 hours in advance, so they're ready when needed. Here, lean principles maximise efficiency and minimise disruption.
It's made a big difference to the way we work. It's made a big difference to the way we control the stock. We've managed to add more operations to the lists due to the material staff doing the picks, and it's just made life a lot easier.
And when it comes to managing staff, lean principles allow for the visual representation of whether the right people are doing the right job at the right level at any one time.
It makes it easier because we can see at a glance all the wards, and anywhere where they're currently trying to get staff, it has a red dot. Anywhere where it's closer to the shift and having particular issues, they can put a red square. It centralises everything. You don't have to go and run round the wards finding out the information. People take ownership for it, it's updated, and it just makes life easier.
The Nursing Resource Board and Pick for Case are just two examples of enablers that allow the clinical teams to focus on care given to the patient. It frees up their time, it allows them to put the patient at the centre of what they do, and actually ultimately allows us to drive our clinical strategy, which is based and focused on the 6 C's of care.
The BMI Way promotes transparency of process performance and enables our staff to have a voice. We have introduced a daily rhythm aligned to the pace of the hospital, where communication or ComCells meet in different departments and where concerns can be escalated up or cascaded down.
So what we're trying to do is, through the ComCells, is give people a voice. So everybody has an opportunity to raise their concern and see through a transparent process that their concern is being dealt with at appropriate level. We also encourage empowerment to help people act. So we've got some amazing people out there that are highly skilled, highly experienced, that perhaps in the past have been bogged down with bureaucracy. So what we're doing through lean principles is freeing that up and empowering these people to act and make a difference. And that's also having a really positive effect on engagement.
Before we weren't doing it, we had no structure. There was probably one meeting taking place on a monthly basis. And as we've gone through the lean operating system and put those processes in place, we've now got capture points where people have a formal basis to communicate.
One paediatric, which should be discharged by lunchtime, and then we'll be using the paediatric unit for adults.
If a staff member raises a concern, it then challenges us as the leaders to respond to that concern. And if we don't respond, then obviously it's remiss of us as leaders not to react accordingly. And that's given us organisational structure and allows us to know what's going on.
The analogy I've used throughout this process is there used to be a fog around Thornbury, and people would make their way through the fog, falling into potholes. And this was as a result of systems that have been in place for many years without a proper review. Process improvement has cleared the fog. We can see the potholes, and slowly but surely we're starting to fill those in and improve processes. I can see it at a glance how the hospital is doing, where the hospital is going, and not just commercially, but also in governance matters as well. So it's a real eye-opener in a very different way of how we develop hospitals within the private sector.
It's worked, it has been embraced. From a communication point of view, that's brilliant.
You can measure yourself, you can see where you're going, and you can communicate to your team.
It's allowed people to be open and honest and voice their opinion about how the hospital runs.
So everybody's used to sharing information, used to raising issues and not frightened to suggest something, so it's been really good.
It's helped patient safety, it's helped cost efficiency, and it has been a wonderful experience as well as something that we will carry on and be proud of.
The BMI Way is to engage and empower our staff to foster innovation and improve the patient experience. We actively ensure that our staff have the tools and techniques to do their job effectively, and we promote creative problem solving to resolve key issues in a collaborative way.
Mr. Razza, good morning, I'm Jill. I know you've been admitted. Can I just go through your allergies with you, please?
The allergy board is incredibly important. We noticed that there was a few issues around patients coming in and we weren't sure whether or not they were allergic to food or drugs. So the staff decided that they needed to use the tools given to us by the lean team, which is creative problem solving, to get everybody together that would be involved in that to come up with a solution. So we decided that we needed to create a pathway so all the surgery staff, all the nursing staff and the consultants knew which patients were vulnerable and we needed to do something about it. Now you've got quick, visible communication, people understand what's going on, and for me that has been the most positive outcome from the lean team.
It's allowed senior management level of thinking to really drill down into some of the departments, where other consultancies might come in and give some facts and figures around what's going wrong and how it could be done. These guys work with our team and really come up with some solutions.
So a lot of this is about testing how engaged the staff are. There's always lots of criticism, people are uncomfortable with change, and so the consultants, the users, need to understand that this is a process that the hospital is going through in order to come out at the end being better. So if you have a safe hospital with high quality, satisfied customers, then people want to come and work here. And that's what the lean process is all about, is stripping out the inefficiencies within the system and improving quality, safety and the patient experience.
The BMI Way has focused on improving quality, but has also witnessed deficiencies across hospitals. Specific solutions can be tailored to different departments, depending on scale and complexity, all of which have delivered step change improvements. In BMI Way hospitals, overall quality of care ratings have improved from 88% to 97.7%. Staff engagement has improved by up to 20%. And overall hospital running costs have been reduced by 3%. Incident control is far more rigorous, with incidents closed within 20 days improving by 26%. Complaints regarding clinical care have halved, and there's been a reduction in adverse incidents. The Care Quality Commission has also commented on the improved communication and governance in all of the BMI Way sites, with Thornbury Hospital in Sheffield getting its best review in 9 years.
It's been very, very good, exceptionally good. Even the young nurses related my history, as it were, and knew what each and every other department had been doing. So they were exceedingly well trained and very knowledgeable. What more can I say? I'm really, really very, very happy.
BMI in the past has been criticised by its teams for not handling change management as well as it could, and the work that we've been doing with process improvement and the lean teams has really introduced a new way of working. When the Care Quality Commission have inspected at a number of our sites, they've been very impressed by the way that the visual management demonstrates the way that the hospital teams are collaborating. It shows them that the communication is happening on a day-by-day basis, and where they've witnessed the work that the teams have been doing in the communication cells, they can visibly see how well the hospitals are being led.
What we've achieved so far is the best example of lean in a hospital environment anywhere in the UK. What we now need to do is roll this out across every hospital and every corporate department in BMI. We need to do it, and we will do it, to maintain our position as the #1 UK private healthcare provider.
The early results have been incredibly encouraging. So being in hospitals where process improvement has been run through are just uplifting. The scale of change, the reinforcement of the autonomy of frontline staff is breathtaking. And I think the potential for the group as a whole, well, it's mind-blowing, frankly. We need to get behind it.